Introduction to Human Resources Management, Chapter 14, Providing Employee Benefits. Employee benefits are often referred to as fringe benefits. These are tangential features of a job outside of salary or pay. Compensation to employees usually comes in salary or wages. We're talking about things that they're getting in addition to that, other than payment or cash. If you have a healthy benefits package, it can help attract, retain, and motivate employees. It can help employers tailor their compensation to the types of employees they need. So if you're looking for a particular person in a particular field, you can do some research, figure out how much money it's going to cost to attract good quality people for your company. And if you have a suitable compensation package, including benefits, then that can help you attract people. You may actually be able to attract people by paying a smaller salary, but if you have a more robust benefits package, they may be interested in coming to your company as opposed to one of the competition. So it's a bit of a combination of salary and benefits combined. If you pay a lot for salary and you have great benefits, you probably will be attracting really high quality employees. However, that's not going to be cheap. So HR and management is always looking for a way to get the best combination that provides value to the employees to be able to attract them, but it also does not cost too much so that the expenses eat into the profits. Many employees really depend on benefits, and if they don't have a good benefits package, they will not be interested in the position because it really does lead to them having economic security. In the United States, as we'll discuss a little bit more, we do not have national health care. So if you don't have a job, you would have to pay for health care on your own, which can be extremely expensive. The nature of purchasing any type of service or product means that if you buy in bulk, it is typically cheaper. That is because the parties selling the service or product are able to make more money by having a higher number of customers, even if their profit margin is slightly lower. If I'm making a 10% profit margin, I'm not going to sell as much because my product or service is going to be more expensive. However, if I drop it to a 5% profit margin, I may sell more of that product or service so that I end up making a higher level of profit at the end of the day. You just have to increase the volume in order to achieve the bigger profit. When you are a healthcare company and you're selling health insurance, the more people you have helps to drive down the costs. Insurance basically comes down to a shared risk, and if you have more people sharing that risk, where you have low-risk people combined with high-risk people, it flattens out the risk for everybody. So the more people you have, it typically drives the cost down. Plus, if I'm an insurance company and I go to a company with 5,000 or 10,000 people, I can negotiate a good rate for them in order to get that number of people into my insurance plan, because that will lower the costs for everyone. That is something that the employer can pass on to the employee because they have that ability to negotiate those rates because they are a desirable customer. It's not just one person looking to get health insurance. It's a company looking for hundreds or thousands of people to get health insurance so they can negotiate a better rate. Benefits usually eat up about a third of what you pay for your employees. So if you're paying somebody $100,000 a year, you can expect their benefits package to actually cost between $125,000 to maybe $140,000, depending on how robust the package is. Where I work, we always consider fringe to be basically a rough 35% calculation. So if we're doing a back-of-the-envelope calculation, if we know that we have to hire somebody at a certain amount, we multiply it by 1.35 to know how much it's actually going to cost to retain or hire that employee in the first place. Certain benefits are required by law. We'll get to that in a few more slides. If a company invests some time into reviewing the nature of their benefits package and they try to use some creativity to come up with what they think is the best package to help attract and retain people, it can actually make you more competitive. So being able to offer a good package will be able to attract people, but being able to manage the cost is really paramount as well. This next slide shows the increase in terms of total compensation, salary plus benefits, over the last 60, 70 years or so. You can see in 1955, it was only about 14.5%. It has gone up over the teens. It went up into the 30s. It dropped a little bit. That might have been a cost associated with the pandemic because there was a recession. Things usually drop in price. There was not a lot of data. Usually this is a lagging indicator. We don't really get the data for it until a year or two down the road. So the most recent version of the book that came out, we only have information through 2022. Most companies, though, do look into the 30% range and above to be able to determine what the cost of the compensation for the benefits package are. Why has it gone up so much over the last 60 or 70 years? Part of the reason is prior to the 1940s and 50s, there wasn't really that big a market for health insurance. I have an article that I'll make sure is included in Canvas that you can read about the nature of how health insurance and healthcare in America kind of evolved over time. But as insurance became more available, people got more access to healthcare. 150 years ago, 100 years ago, if you were wealthy and you told your parents you wanted to be a doctor, they would tell you not to because it was not considered to be a very prestigious or a very high level of money making for a career. Oftentimes people didn't have insurance. Oftentimes the sickest people happened to be the poorest people because they weren't able to take care of themselves. They would go to the doctor to try to get treatment, usually when they're already very sick, which could be a very expensive treatment. If they couldn't pay you, then you wouldn't make any money. With health insurance, it's basically a guarantee that there will be payment for it. And when people know that they're going to get paid and the costs of those are shared amongst other people, it may be relatively cheap for the individual, but for the market, it tends to make things more expensive because doctors don't mind ordering tests or providing treatment because they know that they have a guarantor for the payment. That puts pressure, inflationary pressure, on the costs of healthcare benefits. And over time, those prices have increased at an annual rate greatly exceeding inflation. My own personal healthcare plan, my costs, the portion that I pay as my share, went up over 10%, even though inflation was in the 3% range. Regarding the role of employee benefits, as noted, certain benefits are required by law, and we will go over a few of them over the next few slides. Tax laws can make benefits favorable to employees. The reason that happens is because usually if you're working for a company and they are providing you with the option of getting health care, they have negotiated with a health insurance company to determine what the premium or the rate that you have to pay every month is. The company will not pay all of that. They will pay a portion of it. Typically, they'll pay 70, 75%. If you're really lucky, they may pay 80%. But there's a portion of it that is paid by the individual, the employee. So not only is the individual who's getting the insurance benefiting by the company negotiating a group rate or a bulk rate, which is typically lower, they're only paying between a quarter and a third probably of the amount that actually does cost. So it can result in a big cost savings to the employee. Further increasing that cost savings is the fact that the government has passed laws that allow the employer to withhold the money from the employee's paycheck for their portion of the insurance that is being paid. But they can take that out before taxes are calculated. Now, if you're paying 24% in taxes, that means that you're paying basically tax-free to get the share of your health insurance. So not only are you getting the group rate, not only is your employer paying for a piece of it, you're paying for it before taxes are hit. So you are getting an additional savings in terms of the money that you're spending on insurance. As already noted, employers can get volume discounts, so that does help reduce the cost to some degree. And as we said before, if you have a really competitive benefit package, you can get more competitive recruiting and selection and hiring and retaining of employees. The benefits that are required by law include Social Security. Prior to the 1930s, if you were an older person in the United States, you typically were impoverished. Many times it was not that uncommon for your mother, parent, grandparent to live with you because they could not afford to live on their own. Before there was a benefit package, before there was a retirement package, if you didn't have any of that and you weren't able to develop enough wealth, and if you were a working class person, you probably couldn't develop and save enough money to have a retirement package, what would end up happening is you would just rely on charity or you would rely on your family. I know that my great-grandparents, most of them, when I went back and took a look to see what was going on with my genealogy, a lot of them lived with their family because they couldn't afford to live on their own. What Social Security is it's a government program where they take money from current employees and they save it into a trust fund that is invested, and then they pay it out as a retirement payment for people after they reach the age of 65. Now, you can retire a little bit earlier. Sometimes they give you a benefit if you wait until you're 67. The reason for that is if you wait, they'll give you more money because it saves money for them. The thing about Social Security that you need to be aware of, even though it does make a difference, it only provides a relatively limited amount of income for people who are retired. And if they're on a fixed income, that means they get the same amount every month or every year. Because they're not working, they're not going to get a promotion. It's a retirement package. When Social Security became a thing in the 1930s, the average life expectancy was about 61 years old. And you had to be 65 in order to qualify to collect Social Security. That means that the average person was dead before they could actually collect. Today, the average life expectancy is approaching 80 years. That means that if you retire at 65, you could expect to get 15 years of benefits. 15 years on top of what was provided for before. Most people weren't eligible to collect because they were no longer living. Now people are living up to 15, maybe even more years, and that does put a strain on Social Security. The other issue with Social Security that is creating a bit of a problem is that the money that is collected is coming from a smaller group of people. We talked about demographics before. The baby boom generation was the largest individual cohort of people at that time as a percentage of the population. As they are aging out and starting to retire, people who are working today are the ones that are paying for their retirement, just as they paid for the people who retired before them. The problem is that in the 1930s, we had 15, maybe 20 people actively working for every person that was collecting retirement income from Social Security. Today, it's down to about 4 people who are working to contribute for every 1 person who's collecting. Because of the population decrease and the lowering fertility rates, where people are having less than the replacement rate of 2.1, we may be only 1.6, 1.8 if you don't count immigration, then that means that you only, in the next 10 or 20 years, you may only have 2 or 3 people working for every person who's retired, and that puts a big strain on the system, especially considering that people may be living longer and really taxing the Social Security Trust Fund. Another required benefit by law is unemployment insurance. This is basically a payroll tax that employers collect and send on to the state. So if you're working in Massachusetts and you look at your payroll, you look at your paycheck stub, you will see that there is a line for unemployment insurance. What happens is if you lose your job because of a layoff through something that you didn't do of your own fault, then you can apply for unemployment benefits. And basically it pays you a portion of your regular salary for a specified period of time. It's usually about 13 weeks. It can be extended up to 26 or 52 weeks. I believe during the last Great Recession in 2010, it was up to 2 years to get unemployment. It's basically a way to be able to get income to provide for yourself until you can find new employment. It does not apply if you are fired for a cause, typically, and there are other conditions that you have to satisfy in order to maintain the ability to collect, but we'll talk about that on another slide. There's also workers' compensation insurance, so if you're injured on the job, it's similar in a way to unemployment insurance. You can collect a portion of your salary so that you have money coming in while you are unable to work until you can get healthy enough or rehabbed and then get back into the workforce. Workers' compensation is based on the idea that there is no fault cause here. If you were injured before, you would have to prove that your employment or your employer caused the injury. They just made it no fault now. It's kind of like car insurance. They don't get into who's at fault. If you're injured at work, you are going to be eligible most of the time to collect because they're not concerned with who's at fault. That puts the impetus on the employer to help ensure, through things like OSHA that we talked about before, that you are maintaining a safe workplace and you don't allow your employees or you don't force your employees into situations that would be dangerous enough in which they become injured and can no longer work because of that injury. Family and medical leave is also required by the state and federal government. The federal government has an unpaid family medical leave. That means if your wife or your husband, whatever, your spouse is injured or sick, you can take time off in order to care for them. Same for your parents or children. The federal level, it's unpaid, but the state used to have an unpaid level. We also now have paid family and medical leave if you are in the state of Massachusetts. We also talked about health care. There is government health care to a certain degree. If you are older, if you're eligible to retire, age 65 or 62 and up, depending on the circumstances, you may be eligible for something called Medicare. That is a national health care program, but it's for retired people. There's also Medicaid. In Massachusetts, that's called Mass Health. So if you are younger and disabled, you would be eligible to get health care, because if you're younger and disabled, you wouldn't be able to work and get health care any other way. So the government does provide health care programs. So it's not like we don't have national health care. It's only for certain populations. Under the Obama administration, they passed the ACA, which basically requires any organization with 50 employees or more to pay a fee to the federal government if they do not provide health insurance for them. If that company pays a fee to the federal government, those employees still have to go out and buy insurance so they can use a government-sponsored clearinghouse to be able to find insurance at a discounted rate. You will see in the news that there's a lot of arguments about whether or not this program should be continued, and they're also looking at cutting some of the subsidies that people would get, which would end up driving up their health insurance costs. I may have talked over the slide a bit when we went through the previous slide that had the list. I kind of went through a little bit of it. So the Old Age Survivors Disability and Health Insurance Act, passed by Congress, which is basically known as Social Security, is the program that we were talking about that provides government-sponsored retirement benefits to employees. Social Security provides old age retirement insurance, so that's your pension. They also help along with unemployment insurance, survivor's insurance, meaning that if someone is qualified for Social Security and they die ahead of time, their beneficiaries may be able to collect some money. So if a parent passes away, their child may be able to qualify to get some of the Social Security support. It also includes disability insurance, and it's been expanded to include hospital insurance, which is Medicare Part A and Medicare Part B. These are additional programs on top of the Medicare health program that the government provides for retirees to help close some of the gaps that they have. The program is very complicated, and the coverage packages start at certain incomes, and there's certain amounts of money that you have to pay. So these Part A and Part B, these afford people the ability to purchase supplemental insurance programs to help also reduce their costs. The type of benefits you get does depend on the age. The younger you are, you're going to get less benefits. If you hold off before you retire, you'll get more. It also is based on your earnings history. You have to work at least 10 years, the equivalent of 40 quarters of work in paying into the Social Security system in order to achieve vesting so that you would be eligible to collect money. The longer you work, you will go up to a maximum amount that you can collect. Unemployment insurance is a federally mandated program. It is administered by the state, so if you lose your job in Massachusetts, you would go to the state unemployment office, which is located in Government Center in Boston. They have a website. You can then file to get your benefit package set up. It helps to reduce the unemployment hardship so you can make your payroll, so you can pay your rent and other expenses without falling into a high level of difficulty before you can find another job. The idea is that they are going to give you at least a portion of your money to offset some of the income. It's not going to be your regular paycheck. The department also has a program to help unemployed workers find new jobs. They have job placement programs. Because the amount that the employers pay into it is based on how many people they lay off, the more people they lay off, the higher their rate is going to be for their contribution. So it does give an incentive to not lay off so many people. The more people you lay off, the higher your premiums as an employer is going to be as your contribution into the unemployment insurance program. And again, the whole idea behind it is to be able to maintain a workforce that is capable of doing the work, that they're not going to be idled for too long, that they're not going to be discouraged and leave the area. It will be able to get that workforce more stable. And most of the taxes in the form of the funding for the program, it does come from the employer, although there is a contribution that people also make, and you can find that on your paycheck. In order to get unemployment benefits, you have to meet 4 conditions. Number 1, you have to prove that you were employed. You have to have pay stubs, some documentation from your employer to show that you no longer have a job. You are actually currently available for work and that you are looking for work. You have to be looking for a job. You can't just get laid off and say, well, I got 13 weeks of unemployment. I'm going to have a 13-week vacation. Your job now is to find a new job. And in the meantime, the government will help through this program allow you to maintain your expenses. The other thing is that you cannot be fired for cause. You cannot be separated because you did something wrong, and that you did not quit voluntarily. You can't just start getting a 13-week paid vacation or partially paid vacation because you decided you didn't want to work there anymore. You have to be laid off because there was something that you did not do. It was not of your own volition. So it can't be because you're out on strike for a labor dispute. You can't be fired and you can't quit. If you qualify for all of these things, then you can submit your information to the program and they will set you up for your payment benefit. Workers' compensation, also known as workers' comp, is a state program that provides benefits who have some type of illness or injury on the job. And it could also go to either the individual or it could be to a survivor. If somebody was injured on the job and had some issues, there could be some funds that would be available for their survivors. As I mentioned before, it's based under the principle of no-fault liability. So you don't need to show that the employer was at fault or grossly negligent, meaning embarrassingly negligent. To be negligent means that you have a duty to behave in a reasonable manner. And if you do not act reasonably, you could be found negligent if it causes harm to someone else and that they suffer some type of damage, usually in the form of money or it could be an injury. That is not required under the workers' comp program. You don't have to prove that the employer was grossly negligent, so it becomes a little bit easier for the employee to be able to collect. The exchange for that, though, is even though the employer is giving up the right to have it proven that they did something wrong or that they were liable in the cause of the injury, they are protected from lawsuits. You would have to go through the workers' compensation program rather than filing a lawsuit against your employer in certain circumstances. There are some areas where if you elect to avoid workers' comp and there's a different situation spelled out in the statute, you may be able to sue your employer. But if you elect to go to workers' comp, it makes it cheaper for the employer because they're not going to be worried about going to court. It's just going to be part of this program. You tend to get a little bit more money under workers' comp than you would under unemployment, although it can be kind of similar depending on your circumstances. You usually get somewhere around 2/3 of your regular earnings. It also comes in tax-free, so there is a little bit more of a perk. So like I said, if you're making 24% or you're paying 24% tax rate, the 2/3 that you're getting is obviously less, but it's 2/3 tax-free instead of 100% with taxes. 4 major categories for workers' comp. You can get disability income, meaning that if you're injured and cannot work until you are able to recover, you will receive payments during that time period. You can get medical care, death benefits, and rehab benefits. They can send you to a rehabilitation specialist to help you get through your injury and get back into a workable situation so that you can return to the job. The cost of workers' compensation is based on the type of work involved. Certain jobs may not even qualify for it because they're considered too risky. It's also based on the state where you're located because the cost of living and the expenses vary very greatly across the United States. And it's also based on the experience rating. If you're an employer that has a lot of workers' comp claims, that means that you probably have a workplace that is not particularly safe. If you have an unsafe workplace and you have a lot of people filing for workers' comp, your experience rating is going to be poor, and that means you're going to have to pay a higher contribution than a competitor who has a lower experience rating. So the safer your workplace, the more you can reduce the number of workers' comp claims as an employer, the less money you have to pay into the system. So there is an incentive to make the workplace safer. You should want to make the workplace safer anyway, just as an ethical issue. But here, this is a bottom line money issue. You can actually save money by having a safer workplace because you won't have to pay the government as much money in premiums. FMLA is the Family and Medical Leave Act. For the federal government, organizations with 50 or more employees have to provide up to 12 weeks of unpaid leave. So if you have a child or you adopt a child, if you are caring for a seriously ill family member, that's usually a spouse, a child, or a parent, and it could be your own serious illness, you could take time off, not lose your job, which is the key, even though you will not be paid. You will get that same job guaranteed upon your return. It is a requirement of the statute. Along with that, you have to comply with the Pregnancy Discrimination Act. So we talked about that in one of the earlier chapters. If a woman has a baby and takes time off for family and medical leave, she's also covered by the Pregnancy Discrimination Act. She can't lose her job under either statute. Massachusetts has a paid Family Medical Leave Act, and it's funded through employee and employer contributions. This was passed in 2018, and it's in addition to the federal program, even though it's separate. The federal program does not offer pay. In Massachusetts, it is funded kind of like unemployment. And under the statute, an employee's job, including their pay and benefits, are protected so that they are able to return, and it does prohibit retaliation. The Massachusetts Paid FMLA Act allows up to 26 weeks of combined paid leave benefit per year. You can get 12 weeks for family care or bonding, like if there's a birth or an adoption of a child, you can get 12 weeks off for that. You can also get up to 26 weeks for military or family-related needs. This is paid time off, and it does pay a little bit more than unemployment. Rather than half or two-thirds, you can get up to 80%, and in some cases, if you qualify, it may be even more. Patient Protection and Affordable Care Act, also known as the ACA, also known as Obamacare because it was passed under the administration of Barack Obama. In the United States, employers are not required to provide health care. It is a benefit. But if you do not provide health care under this act, you have to pay a penalty. It depends on the number of full-time employees. So typically, if you're less than 50 people, you can avoid the requirements under the ACA. The other half of it is Massachusetts actually did this before the federal government did. It was around 2006 or 7. They implemented this similar program where the state will require you to have health insurance. As an individual, if you don't have health insurance, you have to pay a fee when you pay taxes. If you've ever paid your taxes in Massachusetts, you'll know what I'm talking about because you have to get the health care form to prove that you either got it from your employer or you've purchased it through one of the Massachusetts programs. The federal government basically emulated that. That was passed under the Romney administration, Governor Romney in Massachusetts. So it's kind of similar. You are required to prove that you have a job that has insurance or that you are buying insurance on your own as an employee. If you're an employer and you qualify because you have the right amount of employees, you have to offer the benefit of insurance or you have to pay a fee to the government. If you're a small business, you can get insurance from the Small Business Health Options Program or SHOP. It's a way to help smaller businesses, which typically don't have as much resources, to be able to participate in the program without incurring a great amount of expense. The ACA is always in the political crosshairs, depending on which party or which view you have regarding insurance. Some people think it's a great thing. Some people want to get rid of it. It's morphed into different varieties of it. They've been funding it differently. It's changed from year to year. So it's relatively complex and it's always changing, and it's kind of goes with the winds of the political system that happens to be in power at the time. So if you're working in HR, you have to understand what the ACA is, both from the employer and the employee side, and make sure that you follow through the compliance requirements. The next slide has a chart showing how many full-time workers have access to various types of benefits. Medical care, a little bit over 70% have the option of getting this. You're not required to get it, but, I have insurance for my job. My wife is working as well. She obviously can be covered under my plan, so she doesn't elect to take it from her job, but she could if she wanted to. There's also optional life insurance. Again, this is basically a pass-through. Your employer can contribute to it, but because they are able to negotiate a rate by getting a bigger pool of people, it usually makes it less expensive. So I have an optional life insurance program from my employment. You can have some retirement plans that are offered by your employer. Usually that falls under a 401k benefit contribution, which is an investment program for retirement. It's very rare that you'll have a company that will have an actual defined benefit pension program unless you work for the government. The state of Massachusetts does have a defined benefit program where if you retire, they will manage the program and pay your retirement pension. Most companies don't do that. Part of the reason is a lot of companies ended up going broke, and it would be hard to rely on a company that may not be there when you're retired to be able to pay for your pension. So a lot of the retirement plans that they have, it's some kind of a combination of an investment incentive. Close to 80% get paid vacation and paid holidays. The amount of paid vacation and holidays may vary. Typically, you'll get New Year's. You may or may not get Martin Luther King Day. You may or may not get President's Day. Most places do get Memorial Day in May, the 4th of July, maybe Labor Day, Thanksgiving, and Christmas. You could get a few more in there. Massachusetts, it's a state holiday for Juneteenth, which is when the slaves were freed or found out that they were freed in the 1860s. So that's in June in Massachusetts. But private companies have different requirements, and they can opt to have holidays or not. They also don't have to give you paid vacation. The standard is typically about 2 weeks. If you're a new employee, they can go up to 3, 4, 5, maybe even up to 6 or more, depending on the nature of the job and what they feel gives them a competitive advantage. Other countries do have different requirements. So if you're in Europe, for example, many of the European nations require the employer to provide vacation. The United States, they do not. The amount of vacation that is given is based on their assessment from HR and management to determine what would make them in the most competitive situation to attract good employees. If you wanted to work for a company that sounded great, but they didn't give you any vacation time, you may not elect to work there. So there would be an incentive for these companies to provide vacation benefits, even if it's not required. But as noted, other countries do require minimum amounts of vacation time. Companies may also provide time for sick leave. Traditionally, you would have a sick leave time bank where you could put hours that you earn every month into a sick bank. And if you have an illness or require surgery or you have to miss work because you have an injury, then you would rely on the sick time to be able to get paid during that time without having to use workers' comp or FMLA or paid FMLA if you're in Massachusetts. However, a lot of companies now are bundling all of the time off that they give for paid holiday, paid vacations, and sick leave, and they're wrapping it into what they call paid time off or PTO. So they may give you 5 weeks of PTO, and how you use it is up to you. It could be a little bit for sick time, it could be for paid holidays, it could be for paid vacation. It's up to the employee to figure it out. It's not quite as beneficial to the employee because if you end up having a cold or something, or you get the flu and you're going to be out a couple of weeks, there's no differentiation. Where I work, I have sick time that is separate from my vacation time, and it doesn't go away. My vacation time goes away every year if I don't use it, but my sick time stays permanently. So if I had an illness or a problem, I would have a lot more flexibility. If you have a company that only has PTO, that's typically a cost-cutting measure because they don't want to have everything included. And if you have a long-term illness, then you're going to have to go on FMLA most likely instead of using sick time. For optional benefits, these are different types of insurance, payment plans, and paid leave. One thing I want to mention about insurance is I want to make sure everybody understands what insurance is. Insurance is basically a contract. And let's back up a little bit more and remind you that a contract is a legally enforceable agreement. It is a promise to do or not do something from 2 or more parties. So I promise to do something or not do something. In return, you promise to do something or not do something. And there is consideration or something of value that is backing that contract. That's what makes it legally enforceable. So if I want to buy something from you, I make you an offer. You're giving me an item and I'm paying you money. I've made a promise to pay and you've made a promise to give. I get the product, you get the money, there's our contract, and it's legally enforceable. So if I pay you and you don't give me what I paid for, I can take you to court and get it back. What an insurance policy is a contract for me to pay the insurance company what is known as a premium, my share, to mitigate the risk of loss. The company that is providing the insurance is accepting the risk of loss. That is what's being sold. If I have a house, that's probably going to be the most valuable thing that I own. In Massachusetts, most houses are running at about $800,000. If something happened to that house, it would be very unlikely that I would be able to pay to build a new one. So it would be cheaper for me to pay maybe $1,000 or $2,000 a year to an insurance company. And what they do is they accept the risk of loss. So in the unlikely event that my house burns down, I don't have to worry about paying for it because I've paid the money to another company and they have accepted the risk. And as long as I don't violate any of the terms of the contract, they will pay to rebuild my house. What the company does is they rely on statisticians known as actuaries, and they calculate risk. What is the likelihood of my house burning down? What is the likelihood of there being a flood in my area? There are some places in America that are so prone to flooding that you can't get flood insurance because the risk is too high and the company would never be able to make money. Let's say in a city of 20,000 homes, 3 houses burn down every year for various reasons. You can calculate the value of those houses and the likelihood that those houses may burn down. You could also give credit to people if they have things like smoke detectors or sprinkler systems that could reduce the risk of there being a lot of damage. They then calculate the cost of this contract, which is known as a premium. You pay the premium. If nothing happens, the insurance company keeps that money. If something does happen, because you paid them value for it and it's a legally enforceable contract, they will come back and build your house or replace whatever it is that you have insured to protect and mitigate the cost of that loss. From an insurance company's perspective, having more people is key to keeping costs down. If I only have one person with house insurance and that house burns down, I'm only getting that $2,000 premium and I'm now on the hook for an $800,000 house. If I have 500,000 people paying me a premium and only a fraction of those houses burn down, I get all of those premiums that I keep. I only have to pay out a few of the losses. What's left over is basically my profit. So the statisticians and the actuaries that work for insurance companies are very important because they're the ones who can accurately gauge risk to be able to put out a competitive cost for the premium so that you can both attract customers and not go broke because you're paying out too many settlements. Other optional benefits include domestic partners. So, for example, I mentioned before I have health insurance. My family is on my health plan. I have to pay a little bit more to get the family plan, but my children and my spouse are covered as well. Prior to 2015, before the Supreme Court of the United States legalized same-sex marriage, people could not get health insurance because it was usually limited to a spouse. Some states that didn't offer marriage did offer what they called civil unions, so that people who were paired up as spouses but not recognized legally as a spouse could get access to health care. After 2015, because you have same-sex marriage, couples that ordinarily would not have been able to get access to health care through their spouse's employment are now able to do so. Paid leave is also an optional benefit. As I mentioned, it can include vacations, holidays, and sick leave. You have to consider things like jury duty and military duty. So if somebody gets jury duty, they have to go out. I do have that included. Some companies may not. If you have military duty, there will be requirements that you at least preserve the person's spot if they're called up and deployed for a period of time. They do have the right under different statutes to come back. But you can also provide paid leave to be able to attract people. You could give them some optional benefit that they may not necessarily be required to extend to their employees, but it could help attract a certain group of people. So if you're in the military, you may want to look at whether or not they have additional benefits other than what the law requires. Some places give you time off to go vote if you can't vote during work hours, or to donate blood because it's considered a public benefit, an ethical thing to do. But there is no requirement for paid leave in the United States. As I mentioned, in other states and other countries, they do have legal requirements for it, but in the United States, it's basically left to the marketplace to determine how much time off people get. On average, after 5 years, you get 3 weeks of vacation, paid vacation, and 10 paid holidays. You can also get sick leave accumulating with length of service. But again, a lot of companies are just merging all the time together in what they call PTO. You could get optional days off for personal days. Floating holidays is if the company, maybe you have a religious holiday that other people don't recognize, you could take that time off and get paid for it. If there's a paid holiday from the federal government, like Martin Luther King Day, but we're open, I may give you that day off. Because we're open, some staff have to work on it. If you work on that holiday, you can then float that time and take it as a personal day some other time. You usually have to have some type of scheduling process in HR to ensure that people who are working the holidays have that ability to come out in some other place. So if your company is open on what is considered to be a holiday, maybe it's a hospital or something and you can't close on Christmas because people still get sick. If you work on Christmas, you'll probably get paid a differential, first of all, but you may be able to bank a holiday, vacation paid day, that you can then use as what's known as a floating holiday and take it some other time. Medical insurance is an optional benefit program, and it's usually through group insurance. And as I mentioned previously, you can get a benefit because of the bulk purchasing of this service. About 70% of full-time employees in the U.S. have the option to get medical benefits. That includes hospital expenses, surgical expenses, and visits to physicians. I guess that would also roll into that being pharmaceutical or prescription drug benefits as well. Now, the article that I'm going to share with you on Canvas that you can read through is something that I wrote a few years ago. It's a little bit dated, but the background is the same. It talks about the history of how insurance came to be in the United States. Before World War II, it was very unlikely that you would be able to get health insurance. And even to back up a little bit more, based on my discussion of what insurance is, it's very strange to have health care be provided through an insurance mechanism. As I noted, insurance is a contract to send the risk of loss to another party for a fee. Typically, you would only insure things that are unlikely to be lost. My house is unlikely to burn down. My car may get damaged, more likely to be in a car accident, but it's still not that common that it would happen. Almost everybody gets sick, so to have an insurance mechanism as the format to be able to provide health insurance or health care to people is a little bit odd. and most of the rest of the world did not use this model that the United States is using. During World War II, what ended up happening is the United States government didn't want there to be inflation. So what happened is we had 6, 7, 8 million people join the armed services between 1941 and 1945. That meant that there were a lot of positions that they were working domestically that were now left vacant. According to the law of supply and demand, if you're in HR during World War II and you're doing a forecast for labor supply, there's not going to be any because a huge portion of the workforce is now in the armed services fighting a war someplace else in the world. Who's going to be doing all the work that needs to be accomplished here? There's going to be fewer people for it, and typically when you have a shortage, it results in cost inflation. If there's only one person to fill 3 jobs, then those 3 employers are going to be paying as much as they can to attract that person. But if you have inflation, it becomes very difficult to support a thing like a war effort. You want to be able to build your planes and your tanks and pay your employees, your military members, without having the cost of inflation making everything more expensive by diminishing the value of the money that you're using. So during World War II, what the government did is they enforced price controls, including wage controls. That means that if you were paying somebody a certain amount of money at the beginning of the war, you could not increase your salary. That would help prevent there from being this runaway inflation due to a supply shock in the labor force. However, in order to compete and get employees to want to come to your job, you can't pay them more money, but there was no restriction on fringe benefits. So health insurance was very rare prior to World War II, but during World War II, employers started offering health insurance because it was a way to provide more value to employees to be able to attract them. They couldn't pay them a higher salary, but they could give them benefits in the form of health care. The government thought that that sounded pretty good, and they continued to provide things like tax incentives so that people would be able to continue to do that. Now, in Europe, after World War II, places like Great Britain, the United Kingdom, they employed the National Health Service. So they created a national health care program that the government controls and monitors and runs. The United States had the opportunity to do that, but they basically just said, look, the government doesn't need to get involved with this because the companies are taking care of it. If you look at it in the abstract, it's a little bit weird. I don't rely on my employer to give me car insurance. My employer doesn't pay my house insurance. But if I want to get health care, I have to either get a job or pay for it myself. So it's kind of an odd situation for healthcare to be in this boat. But it's kind of an accident of history why the United States is an outlier. And it's because of the way that they addressed the shortage of labor during World War II and the price controls that had been enforced. So as noted, about 70% of employees in the U.S. get medical benefits, or at least the opportunity to purchase medical benefits with a contribution from the employer. It does include hospital expenses, surgical expenses, visits to physicians. One way that they can control costs is to include things like co-payments or co-insurance and deductibles. So if you go to the doctor's office, you may have to pay a $20 copay. If it's somebody that's out of network, they're a little bit more expensive. You may have to pay $50. If you go to the emergency room, it may be $100. That's a way that the employer and the insurance company can reduce costs, because if you never had to pay every time you went to the doctor, you might be incentivized to go to the doctor all the time, and that could drive up prices. By making a point of purchase impact on the person getting the treatment by having to pay some money, it reinforces that, yes, this does cost money, and if you want to go to the doctor, you're going to have to spend more to do so. So that's part of it. The other part of it is it does reduce the employers and the health insurance companies' expense, because they're sharing that cost a little bit more with the employee. A deductible is a certain amount that you have to pay first before the benefits kick in. So if you have a $500 deductible, you can go to the hospital and they will treat you. And if it's a $1,000 treatment, you have to pay $500 out of pocket. If it goes up to $100,000, they'll cover whatever percentage of that. But that first $500, that's coming out of your pocket completely. And again, this is known as co-insurance. It's a way to help increase the contribution of the employee to reduce the cost to the employer and to the insurance company. COBRA stands for the Consolidated Omnibus Budget Reconciliation Act. It was passed in 1985, and it allows or requires employers to extend health insurance at group rates for their employees after they're laid off. So up to 3 years, if I get laid off, I can still have access to health care. My former employer, the one who laid me off, will not be paying for the health care, but I will have access through their group rate that they negotiated, because if I'm working for a company with 20,000 people, they're going to have a much lower rate that they've negotiated because of the bulk purchase than I could get on my own. And I will have access to that benefit of having to pay a reduced rate for up to 3 years if I happen to get laid off. Some of the things that companies do to try to keep down the cost of inflation of healthcare benefits, which is exceeding the cost of general inflation by a fairly wide margin. Some of the things that they're looking at is managed care. So you have the insurance company really get more involved in decisions about healthcare, what is necessary, what is unnecessary. There can be a lot of arguments about that between the insured and the insurance companies. They can use things like health maintenance organizations. These are companies where all of the doctors and all of the facilities are located in one particular place. The HMO controls everything. So instead of letting you go out and pick whatever doctor, I want this doctor for my eyes, I want that doctor for my back, I'm going to go to a pediatrician over here, I'm going to get my pharmacy everywhere else. An HMO is basically, we have our own little place that you have to go to. You have all of our own doctors. We hired those doctors based on their skill set, based on their costs, and that's a way to help maintain lower costs overall. A preferred provider organization, or a PPO, is when an insurance company contracts with healthcare professionals at a reduced fee. You have to go to the people who are in those organizations, known as the network. If you go out of network, you may be restricted from doing it, or you may have to pay more money. You may also have access to flexible spending accounts. The government does allow you to put money aside for pre-tax, so it does get that tax benefit, and you can put it in a fund on the side. So maybe you put $1,000 a year on the side. You can use that to buy prescription drugs, things that you have to buy related to medical expenses. It's a way to get that tax benefit to help give you more leverage when you purchase the things that you need related to health expenses. That includes things like your deductible and your copayments as well. Companies can also offer high deductible health plans. This is when you have the deductible that we were talking about. Obviously, if you have a high deductible, that means that the employee or the insured is going to be paying a bigger portion for their costs of treatment. That means that the company will not have to pay that. So if you have a high deductible, $2,000, $5,000, $10,000, whatever it may be, according to the statute, it's about $3,850 from 2023. You have to do that and pay it off yourself. And because you're paying it as the employee, that means the employer is not paying for it. You can read through the book for things like ACOs and EWPs as well. There's a whole lot of different pieces of the menu here that companies can look at to try and save money. Oftentimes, though, employees are pretty savvy to the fact that if the company's trying to save money, it's usually going to cost the employees more money. So they will be keeping score, and they will account for how much money they have to pay for this benefit that they're getting. Is the benefit that you're getting because you're trying to save money not as good as the benefit they could get from some other employer? That's something that you need to be able to keep in mind. Healthcare costs in different countries. The United States is by far the most expensive place to have healthcare. We don't necessarily have the best healthcare outcomes. Ironically, we have some of the best healthcare providers in the world. Mass General in Boston is among the best in the world, the Leahy Clinic, the Mayo Clinic. There's a lot of places in America that have great medical research and services. However, you can only get those services if you have insurance. So a lot of people who are uninsured don't get access to this healthcare system. They don't have very good healthcare outcomes. Even though the United States pays a higher percentage of GDP, close to 18%, on healthcare, compared to other countries that have national health care, we typically have higher mortality rates, higher infant mortality rates, higher mortality rates for women in birth. Lower income people have much higher mortality rates than in other countries. So we're not necessarily getting a bang for the buck that we're paying. Mexico has the lowest level of healthcare costs. Korea, Chile, Canada. Canada famously has national health care. I mentioned the United Kingdom before. And most of the European nations do have government-sponsored national health coverage. When you have national health coverage, you're not paying a premium for a contract for insurance. You're paying taxes that the government then conveys into a program that they run to provide health coverage or health care treatment to its citizens. You may also be able to get life insurance. Now, life insurance may seem a bit odd because I said usually when you're getting insurance, it's for something that's unlikely to happen. The bad news is everybody's going to die. Life insurance should more accurately be called death insurance. You're insuring your life so that if you die, you have your beneficiaries that you name, spouse or children, could get some benefit if you die prematurely. So life insurance, if I'm 90 years old and I've got 6 fatal diseases, I'm not going to be insurable. I'm not going to get life insurance. If I'm 20 and I'm healthy, life insurance companies will beg me to come and be a customer because I'm unlikely to pass away. If my life expectancy is 80, I'm going to pay 60 years of premiums before I get to the point where they need to pay out. So they can actually make money if you have young, healthy people paying into the system. If the only people that were getting insurance were older people that were closer to death, then it really wouldn't be a money-making opportunity. So life insurance, again, you use these actuary tables. They figure out what the risk is, what your background is. And if you qualify for it, you can get either term life insurance, which is a one-off, one-year payment, or you can get whole life insurance, which is more like an investment that you can cash out at a later time. Term life is typically cheaper. Whole life is a little bit more expensive. You may get a bigger bang for the buck depending on whether you want to have the equivalent of an investment that you can pay off later on or just a one-year payment for a term life insurance. Term life gets more tricky when you get into your 60s because it becomes harder to find insurance and the cost of that goes up because the companies expect you to die relatively soon. So it's going to be harder to get that benefit. For life insurance as an optional benefit from your employer, it's the same idea. They simply negotiate a bulk purchase of all of their employees so they can buy in at a bulk rate, and the company will pay a portion of it as well. You could also get optional benefits for accidental death and dismemberment. Again, these actuaries, there are tables, if you go look for them online, they'll put a dollar value on a finger. If I get a finger chopped off, how much is that going to cost? If I lose my leg, if I become blind, there are costs associated with that they've calculated out. And these companies that provide insurance, I know it sounds kind of ghoulish, but that's what they're insuring. They do have to figure out what the value of these things are so that they can provide a product that does provide a benefit to the employees or others that are looking for it. When my children were younger, I had life insurance that was far greater than it is now because I had a house with a mortgage, and if I had passed away, I made the most money in the family. I was concerned that my children would not be able to get the benefit of my finances because I'm no longer there to contribute to the household. When I was younger, the rate that I had to pay was cheaper because my life expectancy was fairly long. Now my children are grown, I'm older, I have much less insurance, but it actually costs me more money to get it. That's because the nature of life, the life cycle being what it is, the older you are, it becomes more expensive to get insurance for that. I do want to do a throwback to the medical insurance and the idea of a pre-existing condition because that's kind of related to what we're talking about here. The ACA, or Obamacare, requires people to buy insurance, and that's been the subject of several lawsuits. The Supreme Court justified it and said it was constitutional, but the statute forces people to go and buy insurance. The reason that they are forced to buy insurance is because, as I noted, the more people who are participating in insurance makes it cheaper for everybody. If the only people who bought insurance are the ones who needed it, so let's say I'm 50 years old and I just got diagnosed with leukemia, and I've never had health insurance because I was healthy before, but now I need to make sure I can get somebody to help pay for my treatment. That's going to be very expensive if the only people that are getting insurance are the ones who are already sick. You're not going to get house insurance on a house that's already on fire. So the idea that the insurance companies are looking at is they want to have as big a pool of insured as possible. You want younger, healthy people buying insurance. You don't want them to wait until they get sick because that's known as adverse selection. If you only had sick people getting health insurance, the insurance itself would be so expensive, it would be almost impossible to maintain, and there would be a large risk that the insurance companies would go broke. What the ACA or Obamacare does by requiring people to buy insurance, you're guaranteeing that these insurance companies will have a very broad group of people, healthy people paying premiums. Sometimes they still need to you could get in a car accident when you're 25 and you still need insurance for that. But you're much more likely to have chronic conditions the older you get, which also are more expensive to take care of. If you have the healthy and the sick all combined, the risk is spread out further and the costs are reduced. The exchange for that is the companies cannot deny people for having a pre-existing condition. That means that if I'm already sick, in the old days, I could go to an insurance company and they would refuse to insure me because I had had an illness before and they think I'm too big of a risk, that I'm going to get sick and cost them too much money. They can't do that under the ACA because they are guaranteed to have a very broad pool of insured. If you get rid of the requirement to buy insurance under the ACA, but you do not get rid of the requirement to eliminate the prohibition against denying insurance to people with pre-existing conditions, there's a possibility and a pretty significant risk that many insurance companies would end up going bankrupt. Because if you're young and insurance is expensive and you don't have to buy it, you won't. If you're older and you're sick and you need insurance, you will. But the companies ordinarily have been able to refuse you insurance because you're already sick. Now, if you don't have the requirement to buy insurance, but you can get insurance anyway, that's going to be a big problem. And that's part of the reason why the government hasn't been able to figure out what to do with the ACA. The parties that want to get rid of it, they know that their constituents want to have this prohibition against denying people for pre-existing conditions. But if you get rid of the requirement that everybody has to buy insurance, then that becomes impossible. You can also get disability insurance. That includes short-term disability, relatively short-term, meaning 6 months or less. Or you could have long-term disability insurance, which could be for an initial period, but it could be extended up to life. So if you get injured on the job, you could get your workers' comp, but if you can't return to the job, this type of insurance would be able to make sure that you had some replacement for your income. You could also get long-term care insurance. The older people get, they may not be able to take care of themselves. Rather than spending tens of thousands of dollars per month to go to either an assisted living or a nursing home, you could also get long-term care insurance. This is kind of like life insurance. If you get it when you're younger, you can get a better premium. So if you pay when you're 30 for 30, 40 years, you get a premium, that's going to be a lot cheaper than paying for assisted living or a nursing home when you're older. They're basically doing an actuarial table. They'll look at your age, they'll look at your health, and the older you are, the higher the bill will be. But if you're paying for that insurance, when it comes time that you have to go and get this, it can greatly reduce the amount of money that you have to spend. So if you're trying to make sure that your children have an inheritance or you want to leave a legacy to somebody, this would help reduce your costs. It's a tricky field. Not a lot of people use it. Some places have had controversies because they've offered it and then they go out of business before the people are able to retire and need this service. So it is something to consider. Not many companies offer it, but some of them do. The next slide shows how many people over 65 depend on Social Security. The amount has gone up over recent years. It used to be just under 40%, but now it's up to 50%. Even if you're retired, though, and you're getting Social Security, a lot of people still have to work. About 1 in 5 people who are technically retired are still working to try and get some income to be able to pay off their expenses. Some people have investments. A very small fraction of the overall population does have direct investments in the stock market. About 10% do have investments. 3% falls under other. I suppose that could be rental units or anything. But other pensions and annuities is your 401ks. So oftentimes it's a combination of multiple things that people use when they retire and they're on more of a fixed income. ERISA is the Employee Retirement Security Act. So if you did have a company that provided a pension to your employees, it created the system that people have to follow to provide greater protection to the employees so that they can be sure that they'll have a pension when it comes time for them to retire. It establishes vesting rights. So that means that if you work for a company long enough, usually it's about 10 years, then you are eligible to have retirement benefits. It also creates portability, meaning you can take your investment package for your pension and move it to another job when you leave and go someplace else. The Pension Benefit Guaranty Corporation is a federal government agency that oversees retirement benefits. So if you're a company that provides benefits, there are certain rules that you have to comply with to ensure that those benefits will be made available to the employees. If you have financial difficulties, the government may be able to do some type of a benefit. They require some payments, etc., kind of like all of the other things that we're talking about with unemployment and workers' comp. But they do oversee this, and if a company happens to go bankrupt and can't fulfill their obligations, the people that were their employees that are now the pensioners, they would not be left out in the lurch without any income at all. Regarding the types of retirement plans, you can have a contributory plan. This is funded by the employer and the employee. I have one of those myself, so I pay a certain amount in. My employer matches it. If you have a 401k, it's usually based on the same idea of matching funds. You can have a non-contributory plan, which is very rare now. It's where the employer pays for all of it. That is going to be more expensive and more of a gold level retirement plan. You could have a defined benefit plan. This is a specific level of retirement income that is guaranteed ahead of time. I happen to work for a government, and we do have a defined benefit plan. So if you work 10 years, you vest. If you work 30 years, they do some combination of the number of years that you've worked plus your age. And if you retire at one age, you may get 60% of your income. If you retire at another age, you may get 70%. The max is 80%. So if you work until you're about 65, 66 years old, you put in 35 years. When you retire, you can get about 80% of your previous 3 or 5 years of your salary. The thing about the state benefit for the pension, though, is they don't really have many COLA expenses. So if you get the 80%, that may be great. But if you live 30 years, it's not going to be worth 80%. It's going to be about 40% in another couple of decades because they don't really adjust it. They only make the benefit available at the time of retirement. There's a small portion of it that does get adjusted for inflation, this cost of living or COLA increase over time. But that's kind of the trade-off. So not many places do offer defined benefit plans. You do have to meet the requirements of the ERISA Act and the Pension Benefit Guaranty Corporation as well. The defined contribution plan is when an employer sets up an account for every employee. It's basically, we're talking about 401ks here. And again, the 401k is section 401k of the IRS tax code. It talks about the tax requirements to be able to get this money available for you when you're going on in the future so that you can retire. You could also get profit sharing and stock ownership plans and the like, but we're really talking about 401ks here. And the employer can match contributions over a period of time. You may have a cash benefit plan or a cash balance plan as well. This is not particularly popular, but each employee contributes a percentage of the employee's salary, and then they have this cash out plan when they retire. Just to give you an idea of the power of compounded interest, if you're 21 to 29 years old and you put $3,000 in an investment vehicle every year, by the time you're ready for retirement, you'll have about $500,000. Now, if you do the math, you're talking about $36,000 a year. That's not going to add up to $455,000. It just means that the first $3,000 that you put in earned some increase in value. Then you put in another $3,000. That compounds. Every year it earns interest on that. So you're both making the initial yearly contribution and all of the money back to the first contribution contribution that you made is getting growth from this investment. That's the power of compound interest. If you wait longer till you're in your 30s to be able to put money aside, then you can see that you're only going to be getting maybe about half because you don't have that extra time. The longer you invest, the more payoff you will have at the end because you have more of an opportunity for those compounded investments to keep building on themselves. As we mentioned when we talked about retiring, you have to work a certain period of years to be able to vest. If you don't vest, you are not eligible to get the retirement benefit at the end. Any company that's providing a benefit for a pension has to provide a summary plan. It's a report that talks about how much money is in the funding, what the eligibility requirements are, what the risks are. It's basically to let people know through a level of transparency what's going on with their retirement. Obviously, retirement is very important. The more information you can tell people so that they can mitigate against possible risks, the more secure they will be when they retire. You can also have family-friendly benefits. You can give family leave. You can pay for childcare. I had a place that had a building that they owned. The basement wasn't really used for much, so they allowed a childcare agency to come in and provide childcare for people who worked in the building. Because they owned the building, they could do it at either rent-free or a very cheap amount of rent. So they're not actually personally providing the childcare. They hired a company and gave them a benefit. And they also said, if you come here, not only can we give you a rent benefit for coming in, we can also give you a guarantee of X number of people. So that makes it a lot easier for the company to lower their rates. Those savings can then be passed on to the employees. So I remember looking outside and seeing the kids playing. People could come to work. They would take their kids to work with them instead of dropping them off at a child care center and then waiting another 8 or 10 hours to pick them up. They could drop them off at work. If there was a problem, they could just go to the child care center on site, take care of them. They could go down and have lunch with them. And then when work was over, they just pick up their kid and go home. So that is quite convenient. And it doesn't have a lot of cost, at least in the example that I gave. It may be more tricky for other companies, and it may be an expense that they don't want to engage in because of the liability problems potentially as well. But it is something that you can offer to people. If you have employees that have children, this may be something that would sway them to come to work for you instead of a competitor. You can also give college savings plans either for the employee's children or for themselves. Some places offer tuition reimbursement or tuition remission. Some of you may work for Northeastern. You can get a benefit. My son works for a college. He's getting his MBA. He's basically getting it for free because as an employee, they waive his tuition costs. In addition to childcare, I mentioned the sandwich generation before. You could have employees with children that they have to care for. They may also have adult parents that they have to care for. They're called the sandwich generation because they get people on both ends of the generations that they have to care for while they're working themselves. So if you have childcare for your kids and you have elder care, which is basically the equivalent of childcare for people who are older, that could also be something that the company could do by providing this bulk purchasing benefit and pass along those savings to their employees. Other things that companies can do is provide subsidized cafeterias. Again, the building that I used to work in, they owned the building. They leased out the room for a cafeteria to a company. Because that company didn't have to pay the rent, the cost of the food there was cheaper, and that was passed along as a benefit to the employees. You could have on-site healthcare services, gyms, dry cleaning pickup, moving and relocation expenses could be paid for. Employee discounts. Again, if you're a bigger employer, you are able to negotiate rates with places. So if you have 10,000 employees and you can negotiate with certain places that you can get a benefit. If anybody's a member of AAA, you will note that part of the benefit of being AAA is you get discounts on things. And that's because AAA has tens of thousands of people that they have benefits for. They can then take that customer base and negotiate with other companies to provide this additional benefit to their members. You can say, look, we've got 50,000 people or 10,000 people in Massachusetts that are all AAA. If you give them a discount, we will refer you to your company. So it's kind of a win-win for the companies that are involved. The employees can get some discounts as a result. That can be an attraction to be able to get people come to work for a company or to stay. I already mentioned tuition reimbursement. Dues for professional organizations. When I was an active attorney, I do have to pay bar fees every year. My previous employer, because I was working there as a licensed attorney, they would pay for my bar fee every year. You could also have off-site company recreations and conferences and things like that you could pay for as well. When I worked for the Department of Defense, I know that the Air Force owns a hotel in Disney World, or the military, I should say, owns a hotel in Disney World. And if you work for the Department of Defense, you could go and stay at that hotel at a diminished rate or a decreased rate. So that's the type of thing. They may have deals with various recreational areas where you can go in and get 20% off or 50% off. Trying to figure out what kind of benefits to extend, you have to look at the goals and objectives of the companies and figure out what the budget is. Do you want to focus on having a really great benefit package, or is this the nature of the work that you do, something that you don't have to really focus on it quite so much? You also have to look at what the current employees are looking at and what potential future recruits are looking at. So if you're trying to reduce costs, you may be, to the great dismay of your current employees, you may be taking action that they won't be happy with. If you're trying to improve things, you need to account for people that may want to work there in the future. What are they looking for? If you don't give a good benefit package, you may not be able to attract or retain quality employees. They may go work for a competitor. So it's always, all of these companies, because they're in competition with one another, they're competing for customers, they're competing for innovation, but they're also trying to keep costs down, and they are competing for employees. So it's important to benchmark to the extent that you can and see what the competition is doing. Obviously, employees expect an employer to provide all of the services and benefits that are legally required. The Bureau of Labor Statistics has a good source of the benefits data that are out there that companies do offer. Employees will also value benefits that they're likely to use if you give them a lot of things that they don't care about, kind of like that incentive program that we talked about earlier. If you're giving them a reward that they don't care about, then it's not going to be attractive for them. The thing about some benefits, though, is it's usually a good idea to offer some variety because some employees will care about benefits more than others. If a person is working there and they don't need insurance, then they're not going to care about it because their spouse has insurance that they're covered under. Some employees maybe don't care about tuition reimbursement. Some may. Because there is some variety there, you may have some plans that you are spending money on to maintain, but you have to decide if it's worth it based on the number of people that are actually using those benefits. You can also use the benefit plan when you recruit people. I remember very explicitly telling people, hey, if you work here, you'll have this many weeks vacation. We have a great benefit package. You get time off, holidays, whatever. Because we worked for a place that didn't pay a lot, but we did have a really great benefit package. So I did bring that up when I was trying to get people to come and commit to work for us. In terms of selecting the benefits, you need to figure out what types of things the industry that you're working in considers normal. You could offer a cafeteria-style plan. If you go to a cafeteria, they have a menu, and you've got a million things on there, and you can mix and match all you want. That's a great benefit for employees in terms of benefits because I can say, oh, I want that type of long-term disability insurance, and I want an HMO instead of a PPO. I have all of these opportunities to use and choose from. However, while that is a benefit and could be very attractive for your employees, it is very expensive for the employer because you have to maintain and manage access to all of these different types of options. You do have to make a value judgment at some point. How many options do we provide? What's the sweet spot where we're attracting people but we're not spending too much money? You don't want to spend too much money and maybe it doesn't pay for itself because you're not attracting the right number of employees or the right quality of employees. So HR has to work with management to really figure out what type of packages you want to offer that provides the best benefit for the company. Costs are increasing at a rate higher than inflation, so a lot of companies are trying to reduce costs by going to PPOs and HMOs and other types of healthcare plans. They are shifting more costs to employees in terms of coinsurance for deductibles and copays. They may exclude certain coverage for types of treatment. That gets very controversial depending on the nature of the stuff that's being provided. They may cover certain drugs but not others in an effort to reduce costs. So it's really incumbent upon HR to work with the various providers out there to find out what types of treatments they offer and which ones give the best value. A lot of insurance companies are being proactive about this and trying to look at what types of hospitals and which doctors provide the best services so that they can contract with them and put them in their provider network. Because if you have a good doctor who has a record of having good results, it may make sense to include them even if they cost more because they're a better doctor. You get a better payout. If you have a very cheap doctor that just helps get your people sick and require more treatment, that's not going to really help. So a lot of insurance companies are trying to help the employers make an easier call by managing the way that their programs are put together. We mentioned the tax treatments. If you have a qualified plan, you don't have to pay tax on the share that you're paying as a contribution to get your benefits. For retirement funds as well, you can get tax-free earnings. A Roth IRA is a little bit different. If you have an IRA, an individual retirement account, you put it in tax-free now, and then when you take it out, you pay taxes then. So that's a deferred taxation. Why would that be an attractive option? Today, let's say you're employed, you're at the peak of your career, you're probably making more money and you're making more taxes, or you're having to pay more taxes than at any other time. Later on, when you're retired and you're relying on this investment income through your IRA, your income is going to be less because you're going to be retired, you're not going to be working, it's going to be a fixed income, and because your income is less, your taxes at that time would likely be less. So you pay tax deferred now so that when you do pay taxes later, it's less money. Another option is something called a Roth IRA, where you do put the money in post-tax now into an IRA, which is an investment account where they earn money over time and compound the interest. Then when you retire, you can tap into those funds, but you get it tax-free. So it kind of depends on the individual's situation. Am I making a lot of money now and I have a better benefit from doing tax deferral, so I pay taxes later when it's released? Or do I just eat it right now and pay taxes now, and then I don't worry about taxes going ahead? It probably makes sense to do a little bit of both, because I could hedge my bet. Maybe taxes go crazy because the debt becomes a problem and they jack up prices later on. If I have a Roth IRA, it's going to be tax-free payouts later on. So those are things to consider when you're looking at the types of benefits that are being provided and the types of decisions that your employees may be considering when they decide which ones to use. As noted earlier, anything that you're doing with employee benefits, all of the anti-discrimination laws apply to them. So anything regarding race, sex, age, disability, pregnancy, older workers benefit protection, the ADA, all of those things that relate to you can't not hire people, you can't fire people on the basis of that. You also have to provide benefits on a neutral basis under all of these laws as well. Because a company has access to all of these programs that they're offering, there's a lot of money changing hands. There are a lot of requirements regarding accounting. So the Financial Accounting Standards Boards, HR is going to have to collect a lot of money. How many companies do you have for insurance? How many employees are insured? How much money you're withholding? How much money is going in? How much money is going out? There's a lot of oversight here, and that's part of the reason it's so expensive. Because it's so confusing, again, we've talked previously multiple times about making transparent communications to employees. The more information you give them, the more you empower them to take action on their own, the more they understand what's happening so that they're not surprised about anything. And if you're not surprised about anything, you're less likely to have some type of a conflict or a complaint. So if you have good communication, you can get information about the benefits. You can use that to market yourselves and get new talent and retain talent that you've got. Well, as I said, it's very complicated information, so the more information you can provide to people in a clear, concise method will help people make decisions and appreciate the benefits that they have available to them. That's going to be it for Chapter 14.